Right. Today, what I thought is, we have finished most of the lectures we are supposed to do. I thought of teaching you all how to write an answer for the final MBBS exam. Okay. And I thought we will take our exam paper that is on the November 2020, last paper. And then all of you should be able to see it. I have put the answers also, then you are not under stress. Don't worry, I'm not going to ask you direct question from you all. Therefore, please relax yourself and try to put what I am telling to your brain. Then you should be able to retrieve when you go to the exam. That's the purpose of this lecture. Right? Right. Just imagine now. I think I should tell what you're supposed to do day before the exam day. Exam. Other you might feel sort of blank or blind, but nothing inside. I can remember when I was writing part 2 exam, my medical student Kale, I was in the discussion with my colleagues in the canteen. It was I thought I don't know anything about the paper was pathology. Pathology was subject, and then I was blank. That can happen to you. There was nothing to worry. When I didn't bother about it. I went. I just got the paper, sit down, and then sort of think about myself and read the question paper. Everything comes very well. Nicely answers are coming and writing very quickly. There are that kind of things happen. Eva loku deva නෙවෙයි. ඉතින් මනස අවුල් කරගෙන වැඩ අවුල් කරගන්නේ නේ. ඒ නිසා ඉස්සෙල්ලම වැදගත් දේ තමයි day before the exam. අපිට හෙටනම් exam දෙන්නේ today. You should relax yourself. Right? Don't try to read so many things because it's not going to go into your brain very well. ඒක නිසා තමයි what I am telling you always when you are having lectures, when you are listening to lectures at the end of the lecture or at the end of the day before you sleep, please make a short note. Now, even today, what I'm discussing the MBBS paper, just make a note on that. What are the things that I highlighted? What are the things that you need to add? And things like that. Make a small short note. Collect all those things in your file. And then, day before the due date, what you need to do is you go through that kind of things. It does not take much longer. Maybe 1 to 2 or 3 hours, everything you can finish and relax yourself, have a nice bath, eat whatever you routinely eat in, don't take anything from outside and things because you might get a gastroenteritis and all sort of things and the once you are vomiting, food poisoning. And it's happy, relax yourself, have a nice bath, listen to a song and that kind of things and have a good sleep and then go following day morning, refresh yourself and then go to the paper. That's what you should be doing. And then I can do this. I know the answers. I can do this. I will pass this exam with colors. No doubt about it. All of you can do that, right? Then, the question what was given in our last paper. Discuss the methods available to monitor the well-being of a growth-restricted fetus. We always set a long essay question as a first question. What are they? As examiners, what we want is to assess. And this was suggested when the Professor Malik was here. And I can remember, Prof was very concerned on this because as doctors and as a specialist or as a normal person, when you face a problem, you should be able to work out in a sort of, broader manner. This is not like a structured essay. This is a long essay. But when you answer in the long essay, number one, you need to read the essay very well. Discuss. Some of the key words are there. Discuss. So this is not the describe. The discuss. It's not the critical evaluation. Usually we don't set that kind of questions with the undergraduate people. But obviously, the postgraduate, you are supposed to critically evaluate. You need to tell what are the advantage, what are the disadvantage, what are the current evidence, and what is your opinion at the end of the day. Things like that. But we don't ask like that kind of. That may be a deep analysis. We don't ask that kind of things. Therefore, what we ask is basically can you formulate an answer in a sort of the thinking of a topic broadly, and then write down some of the things that you need. Right? Discuss methods, keyword methods available to monitor. There are methods maybe you have heard but not available. But methods available to monitor the well-being of a growth restricted fetus. Fetal growth restriction, some people talk about intrauterine growth restriction or fetal growth restriction. Now, discuss methods available, monitoring for the fetal growth restriction. That's all. Now, what are the things? Right? It's important. Now, basically, the methods available to monitor. Now, history is important. Why history is important? Now, here you need to write some sort of introduction to the answer. Introduction is important. Body, long essay questions, answer should be introduction of the head, body, and the tail. That's what you should be doing, right? Now, basically, introduction is important you to monitor. What is the importance of monitoring the growth restricted fetus? Why are we monitoring? Why can't we sort of them to have a normalized pregnancy rather than we medicalize it, right? With fetal growth restriction, we get it down very frequently to the clinic, or we may admit to the ward. We do some monitoring. Why are we doing that? Because we know they are compromised inside. That fetus is compromised inside the uterus. Any moment, she can die, or he or she can die. Baby can die. Death in utero is one of the major complications that we are facing with the fetal growth restriction. Therefore, it's very important you to monitor them very carefully, and they take. And then you need to have what are the sort of you need to be alert on complication. Number one, death in utero, or maybe the other complications, right? Right. And then what are the interventions that you can do? Therefore, to make decisions to intervene, you need to monitor them. Therefore, monitoring is important. That is why we are monitoring. Now, if you come across a patient in the not having growth restriction, in a 36-week onwards, you may see maybe every weekly or maybe every 2 weekly sometimes, right? If the less risk, you don't want to review routinely. But the growth restricted 36-week, you admit to the ward. It is a cumbersome to the patient, but still you do that because that you need daily monitoring, right? And that is important. Now, what are the things? Risk factors, history, you need to ask. What are the risk factors of the history taking, right? Example, whether she's having diabetes, hypertension, right? And those are important, right? And the other complication like SLE, systemic lupus erythematosus, those patients can have stillbirth very quickly, and they are the people prone to get growth restriction as well, right? And then you can have a fetal abnormality. That is the main sort of a problem with the fetal growth restriction. That is why you need to do an ultrasound scan by yourself if you are expert on that. Otherwise, a consultant radiologist or fetal medicine people, just to make sure everything, are not missing the abnormalities. We may miss, but still better do whatever possible thing to be you trace. And then I think we know, especially in history, when you are going through the antenatal record, history, not only what you take from the patients, please go through the antenatal records very well. Because that is why mom carry antenatal records can't. Right? Maybe a paper, maybe a book, or maybe a booklet, whatever it is. And go through one by one. Have they done a uterine artery Doppler at 24 weeks? Some of them, high-risk people, we do that. And also they show some abnormality. Then you know that category is a risk, higher risk. They can have a death in utero very quickly. Better deliver them rather than hanging on to them, right? That's the history all about. And what about the maternal feeling? What about the fetal well-being? For example, kick count chart. How competent mom is maintaining the kick count chart. how knowledgeable she is. Some of the moms, even though we explain, they can't understand. That is the other problem. You have to be very careful on that, right? That you need to be careful because sometimes what happened is that you say to look after the baby kick count chart, they will not do that. They don't know, they have no idea. I explain. Baba dangalana eka පැයකට කී සැරයක් දැනනවද? දැන් දඟලන එක කොහොමද දැන්? Explain in the language they can understand. Sinhala, Tamil or whatever it is, Muslim, the language that you are competent and the patient can understand. If you can't, please ask somebody else to explain it. I think use the mother tongue is better for them because they will understand well with their mother tongue. When you are under stress, always your mother tongue will tell you, then that will clarify everything better, right? It is important. You can't just, put your things in a way you want and, that can be. Right? Now, example, especially kick count chart, you give a chart, within 2 hours, there comes a doctor, baby kick 10 times. Because when a baby is sort of, as a lump, at the sort of, structure, head, buttocks, hands, and the limbs all are there. Therefore, whenever the baby, do a somersault in or move in, what happened is, baby, touch it with the head touch, then the shoulder can touch, and your hands can, limbs, they count one by one. 4, 5 for each movement, and then 2 movements, they did 10. That's not going to work. Therefore, you explain it very well. Then when what are the other important things? Now, example, abdominal palpation. You see, that is also important. That is why you admit them. That is why you do things very well, right? Abdominal palpation, they are really good as a, when you compare other tests, that is also one of the good. Sensitivity, specificity may not be that high, but still they are really good. Fundus height. That's important. Fundus height, you need to measure. For example, 36 weeks. When you measure the fundus height, 30 centimeters. There's something wrong. Obviously, it is not compatible. Therefore, that is why even in come to exam, even when it just think about this as a long case, your final clinical exam in obstetrics, you tell the examiner, look, yes, I examined fundus height. That was 30 centimeters, but the period of gestation is 36. Therefore, this is not compatible. This fetus is basically growth restricted or small for gestational age. You comment. Then and there comment when you are discussing your long case. Because the examiner love it and then it's good. It's a good student will do that. Right? You can't, now example, now it may be 36 period of gestation. You come as a 35, no, 33. You say it's less, maybe 36, 33 means 3 with Radu. 32 what is less. But still when you measure another measurement, another week time or 2 weeks time, or week time we'll see, it comes to 34. That means baby growing all right. Size is small for gestational age. Mom small, father small, and baby small. Therefore, that's the small for gestational age. That is not a pathological issue. That baby not going to die soon. Risk is when you compare with the other fetal growth restriction, right? That is a small for gestational age. Imagine she's 34 now, 32 now. When you 2 weeks time, you measure still 32. That's not growing. That's something serious. And then you need to stress that fact. Even when you are writing, you say fundus height, not improving, not achieving. Then there's a big issue. Therefore, not just one measurement. Serial measurement is important. Highlight otherwise you can't get marks. Then customized chart. Now when you wherever you work, you have even now our normal routine local clinic given by the public, this Family Health Bureau, and the antenatal records that still contain a customized fetal chart. Then you identify it and you plot in the chart. See where you are, where your mom, where she lies. Then you can comment. It is more sort of objective, basically, because then you will be able to see it nice. Graphic representation, easy to understand, tell the future problems, and then that's you need to stress that fact is important, right? Ultrasound scan for them. We talked about history, we talked about abdominal examination, clinical examination. You see now that's how it goes. And then it comes to we are plotting charts and things. Then it's important, the ultrasound scan, that's another way of assessing the well-being of the growth of the restricted fetus. Ultrasound scan. We do ultrasound scan for various reasons when it comes to maturity, right? Abdominal circumference. Estimated fetal weights are very important because the abdominal circumference, just imagine you have your good tummy, and that does not mean all the people with tummy eating quite a lot, they may be less eating, some of the people not having tummy eating quite a lot. That's a different, but anyway, it has some insight for abdominal circumference and estimated fetal weight. Again, entire chart, plot in the chart. That is very important. That's how science practice. You practice science. You are a doctor who practice science. Therefore, plot in the chart. Cut-off values then will be given, and that will be there. The fetal growth, how does the growth take place, right? Every weekly or 2 weekly, you do that, right? And then the other thing is, especially if you think there's a fetal growth restriction, then umbilical artery Doppler flow, PI and RI value are important, right? Partial index and resistance index, they are important, right? And that is how it is important, how the Doppler, whether Doppler waves are good, whether it is reduced, whether it is increase RI value, or whether it is reverse the value, whether it is absent value. It's like that. You make just a sort of a general comment on that, right? And you have imagine that you have 2 hours for the paper. 2 hours. We have 5 questions, right? 60 minutes, right? 60 minutes, 120 minutes you have, right? And the 5 questions. Then you need to calculate the time that you need. And if the question is easy, you can take it and you can write it quickly and then move to the other one, right? Because that is the other way, because then you can time saving process. That is also you have to keep eye on that, right? That is important. And then other important thing, history unknown, examination chart plotting ultrasound scan then the CTG, cardiotopography is also important. What are the use, right? Again, now these are not remember, when you are measuring the growth restricted fetus, remember, what all measurements are not direct measurement. These are indirect regarding the fetal hypoxia. Hypoxic brain damage we are going to assess. The threat and how badly the fetus affected you are assessing in an indirect way. Because unfortunately, they don't have a direct measurements. That is the other thing. You don't have a direct measurements, right? And therefore, indirect ways you are using. You say that CTG we do the indirect measurement. How the CTG, right? Limitations are indirect. Just what CTG says may not be exactly correct, right? Now you need to see how about the heart rate, reactivity, how the accelerations. Now we are doing the antenatal CTG. If you come across a deceleration, that is significant, right? Whether there's a contraction there or not, because the antenatal CTG, you don't expect deceleration to be present. If the patient is in labor, that is another scenario. But here, the deceleration is significant. Then variability is one of the most important parameter. Remember, that shows how competent the baby's heart, how how oxygenated they are, right? Variability is one of the very important factor when you come to the CTG. Point out that that's important. Variability reduce, you better deliver, right? And then the advantage and disadvantage. There are a lot of false positive, right? But you need to understand that's how a CTG is going to be. CTG you need to do. We can do a snap CTG, 10 minutes, or maybe a lengthy CTG. If you want to save the CTG papers, we may do a 10 or 20 minute CTG because we can't waste. Cost cutting is important in every aspect. As a good doctor who practice medicine, MBBS, Rona, should think about cost cutting as well. Because you are working in a developing country, Sri Lanka. Right? It's not easy. Therefore, don't just waste these papers. They're expensive. I can remember sometime in the ward, we may find we don't have a CTG papers. That's possible. Therefore, you need to be very careful. Then again, the role of venous Doppler and middle cerebral artery Doppler studies are also important. If you write about it, you may carry mark because that is given in the marking scheme, right? That is also important, especially the venous Doppler and the middle cerebral artery in the symmetrical fetal growth restriction. They are really, really important, right? Biophysical profile. Again, what do you mean by that? That CTG and ultrasound scan finding everything together, right? And that's also you need to explain about. Then the intrapartum fetal monitoring, because the fetal growth restriction, they have given the question, you go back to the question again, available to monitor the well-being of the growth restricted fetus. They have not mentioned whether it is the antenatal period or during labor. You need to write during labor as well, because the examiner expect answer, lengthy answer, with a long question. And then say intrapartum fetal monitoring, continuous CTG monitoring is one of the important things, right? Now remember, the fetal blood sampling we have it available in our unit also, we do that. But the pH, we can do it with the fetal. Lactate, we don't do it. Lactate also can be done, but the fetal lactate is also possible to do it, but not freely available. That is what we expect the answer for this question, right? At the end, you can write all these things, but you need to have some end also, because it's an essay question. Therefore, you can write something that you feel about it, right? Even though we do that in the fetal growth restricted fetus, all these instruments, all these tools we are used, but still we lose babies, or still we lose, or we still still the obstetrician have a challenge. Current obstetrician facing a challenge, reducing the perinatal morbidity and mortality. That kind of end. Maybe better than sometimes you maybe come out with some better answer, but you can write down whatever it is, right? Then that is the answer for the first question. Discuss the methods. Right? Lengthy answer. All these things should be included here. And the other important thing now, last time when I'm correcting papers, handwriting horrible. You have, doesn't matter, we don't expect you to write as very pretty, very handy, but legible when known. Legible means somebody should be able to read, it should be readable and understand what you have written. Unfortunately, sometimes you may have written correct answer, but we can't read as examiners. Then how can we give you mark? We are not genius, right? We can't read your brain. We can read your handwriting. We are not talented or competent enough to read your brain so far, right? But we can read your handwriting, provided you write legibly. What I advise is better fairly good sizable letters and space the answer, then it'll be all right. And if you want to draw some diagram, but you can draw a diagram. That will give you a more additional marks. When you draw a diagram, it comes additional mark, right? And that's what it is. Have I no point in writing lengthy? And no point in me to maybe another some other things you may have to be able to put it. But this is not a PhD thesis. This is a final MBBS answer within 15 or 20 minutes, right? Maximum half an hour. Then what you do? That's what you need to adjust yourself. Then you make a comment. The practice can make a mama make all then it's not going to work. You write down, you sit down yourself. That's what I did when I was writing for my MRC or even what I did, like writing for your O level and your A level and scholarship exam. You sit down, you put your clock in front and the time in, sit down, and because there's no point in just thinking, imagination is not going to work. Fantasy world in the with the exam, when you come to the exam, brain does not retrieve what you wanted. Brain train that's what you should be doing. Are there any questions? You write down yourself and see how it is going to be. The man is not difficult. Then discuss the methods available to monitor the well-being of the fetal growth restricted fetus. It's not so. It's very easy, very few things which I have been doing every day. In the way, history examine continuous CTG monitoring that's easy. And right you have to be always consider the language also, because sometimes there's some problems come with the people who can't write very well in English. But you have been doing that now for 5 years now, then 5 years later, you have been here for a longer period. So I just read about it and get the feelings and write basically grammar, but whatever you write should be able to understand. That's also important, right? Okay. And my ilang question good questions then බලන්න ඊළඟ එක. ඒක දැන් පළවෙනි එක අපි ඔබ්ස් ක්වෙස්චන් එකක්. ඒක long essay එකක්. ඊළඟ එක long essay එකක් නෙවෙයි. This is structured essay. We have structured it. They are really good because it is good in for you all also feel better. එකට deep analysis එකක්ම එන්නේ නැහැ. But and a precise answer, precise and concise answer, and also easy to assess. We are also in a better wicket because we can also mark easily then. First question is difficult to mark. Take a long time. Because when you have 170, 200 to 300 now, in future 300 students are supposed to come to the faculty. 300 lazy. But this is going to be structured, they say, make everybody's life comfortable. And question a 48-year-old estate laborer. That doesn't matter. Present estate laborer material, right? To the gynecology clinic, 48-year, right, with the history of postcoital bleeding for 4-month duration. Just think about postcoital bleeding for 4-month duration. Right? The 48-year-old. That's what I'm 24-year-old Navy. Perimenopausal age. මනසට බ්‍රේන් එකට දාගන්න ඕන දේවල් perimenopausal age එකේ අම්ම කෙනෙක් අවිලා ඉන්නවා 4-month duration. Speculum examination reveals friable growth at the anterior lip of the cervix, suspicious of cervical carcinoma. එහෙම දැකලා තියෙනවනේ. එහෙම දැකලා තියෙනවා නිකන් බැලුගාම කියන්න පුළුවන් නේ cervical cancer කියලා ගම්ම. දැන් මම දන්නේ අපි දැන් කොච්චර කාලයක් කෙනෙක් එකේ මුදුන වයසට ගිහිල්ලාම කෙනෙක් එකේ ඉඳලා smell එකෙන් කියන්න පුළුවන් ගොඩක් වෙලාවට we are having a cervical cancer patient. That අමුතුම smell එකක් එනවා when you are having a cervical cancer spreaded patient ඉන්නවා නම් අනිවාර්යයෙන්ම that smell is there. කෙනෙක් එකට යනකොටම කියන්න පුළුවන් today we are going to see a patient with this kind of a problem. අන්න එහෙම. එතකොට දැන් මේ suspicious We have not diagnosed. Clinical suspicion. එතකොට අපේ දැන් keywords තමයි 48 perimenopause. Labor, state labor තෝරන හිතා ගන්න පුළුවන්, but not much value. But gynecology clinic, then the obstetric එකක් නෙවෙයි. Postcoital bleeding, then obstetric එකේ නා postcoital bleeding. නම් අපි හිතමු අපි දැන් pregnant කියලා. මම කට මිස් කරද මෙතන එහෙම නෙවෙයි gynecology කරයිලා තියෙන්නේ. Speculum examination basically reveal growth in the anterior lip of the cervix. දැන් බලන්න question එක. How would you confirm the diagnosis? දැන් මොනවද දැන් ඔයාලට හිතෙන්නේ? cervical cancer නේ. cervix එකේ උඩනේ තියෙන්නේ. මේක vaginal cancer වෙන්න බෑ. But vaginal cancer also spread to the cervix also possible. Other cancers distant will come to the cervix also possible. But those are rare situations. Think common things are commoner. ඒවා ඉස්සෙල්ලා හිතන්න. Don't be try to be think too much. මේ දැන් නැගලිම easily. How would you confirm the diagnosis? Marks විස්සක් දීලා තියෙනවා. අරගේ full 100 දුන්න ඉස්සෙල්ලා එකට 100 දෙන අර ඔක්කොම ලියුවා. හරි. ඒක ටිකක් ලකුණු ගන්න අපහසු වෙනවා. දැන් මේක ගන්න ලේසියි. මොකද සමහර කොටස් දන්නේ නැතත් if you don't know the part 2 but you collect the 20 and another 30 from the long last part you pass the exam. Like that make it easy. දැන් බලන්න මොනවද ලියන්නේ. How would you confirm the diagnosis? මේක නිකම් බලලා වැඩක් නැහැ. Examination and anesthesia is a must. Just because you have put your speculum in. Remember, මම මෙතන පොඩි පාඩමක් කියලා දෙන්නම්. හරි වැදගත් ඔයාලට. When you go to the gynae clinic, don't put your bloody speculum first. Why? I can still remember when I was a senior registrar in Jawaharlal Hospital. Mom came. I think she is 8 years or very old mom and having 8 children. He came with just a bleeding, postmenopausal bleeding. My house officer, what has done? Our house officer has put a speculum. That is how you need to understand. Start torrential bleeding. Nobody can stop. She died on the table. What happened? That was a friable cervical cancer with the speculum. You damage the tissues, start bleeding. I came, I was in a register, I came and what we can do is apply a pressure and patient. She died. That is the problem. Please don't put your bloody stainless steel speculum into the vagina straight away. Put a gentle finger, proprioception, and a gentle finger. This will tell you everything very well. That is why I can remember when I was my previous teacher of LAW Citizen, he used to say, this finger is much better than ultrasound probe. In way that he is correct. Why? Because the proprioception is there here. Whatever you feel, this will sense you, but not the speculum. And so you have to be very careful. Put your finger gently and see what are you dealing. You have to be very careful, gentle. Right? And it's an examination and anesthesia. Even that, please use the finger first. Right? Like 5 marks. Staging. How do you diagnose that? What staging you can do? Because when examination, what is the size of the thing? It's in all the vagina, upper third, lower third, and the broad ligament, vaginal rectal septum. The biologic document. Staging examine anesthesia, right? Then you take a biopsy. The biopsy can be taken various ways. Sometimes when you put a finger, parts comes. Then you don't want to break it with some other instrument. Don't put another instrument. If you get a part that is coming from there, when you put a finger, you send that one instrument. Why I put another one? Understand? The friable growth, if it doesn't come, then you might have to use the cervical biopsy, punch biopsy forceps. Or the piece you can take, corn biopsy, or whatever it is, you take a piece of the tissue. And you use histology form, you need to fill very well. But in general, you need to remember name, age, your suspicion about the condition, and the last regular menstrual period if she has got it, or previous histories if she supply with. Please write down everything because you should make a pathologist's life comfortable as a clinician. You can't expect pathologist somewhere else. She is using the microscope and she try to work out on various things. But if you give some clues, she will be able to do that, and she will be give a good correct diagnosis. It's a UA staging biopsy fiber growth. ඒක තමයි අපර 20. හරි ඉසිනේ. වැඩි වෙලාවක් යන්නේ ටක් ගාලා ලිව්වා ආන්සර් එක පටක් ගාලා හම්බුණා. Right? Then your name two main histological types of cervical carcinoma. And easy. And the person who knows about it, write down squamous cell carcinoma, commonest one. Adenocarcinoma is there. That's the game. Very easy. This kind of things are there. But you can write mainly two main histological types. Two main remember, right? Briefly describe the principles of management of this patient if the diagnosis is FIGO stage 1 carcinoma of the cervix. Right? Stage 1. Any question, Pruta? Right. Briefly describe the principles of management of this patient and the patient if the diagnosis FIGO stage 1 carcinoma of the cervix. Then බලන්න අපි කොහොමද answer එක formulate කරලා තියෙන්නේ කියලා. This is, remember, this is not a long essay. This is a structured essay. අර වගේ length ලියන්න යන්නේ නැහැ. This is a case of a macroscopic stage 1 cervical carcinoma. This is not a microscopic. 1A, 1B, 1C මතකයිනේ. If you go to the FIGO classification, අද ඒක අනිවාර්යෙන් බලන්න ඕන. Therefore, local excision not valid for this patient. මොකද macroscopic කියන්නේ it has already gone in, already spread around the area. The local කරලා හරියන්නේ නැහැ. Not valid for this patient, right? Otherwise, even if you just 1A or maybe a cervical, even a cone biopsy may be adequate, right? Provided the edges are not free of cancer. Make him a macroscopic look. There are two modalities of treatment can be used. Two modalities. You have to do a basic principle. Surgical management and radiological management. What is the surgical management? That is called Wertheim's hysterectomy. That was the old terminology that we use. Also, we use the radical hysterectomy and the nodal dissection. The nodal dissection, the pelvic nodal dissection. 1/3 of the vagina also we remove because that is what we don't want to leave any part with the remaining or residual cancer. We need to remove as much as possible, right? Uterus, ligament, and cup of the vagina removed. That's 1/3 of the vagina. Vagina we have to remove because the vagina becomes shortened a little bit, but that will be all right with the time. But that we need to remove. In addition to that, internal ileac, you see, external iliac, common iliac, and obturator lymph nodes should be removed. There are things. As a candidate, you need to write all these things. Right? We are given 60 marks for this. To get this 60 marks, surgical management, Wertheim hysterectomy, that doesn't carry 60 marks. Remember, you need to write surgical options and radiological management. So, Wertheim, this is what you are supposed to do. Uterus, ligaments, cardinal ligament, and uterosacral ligament, and then the cup of the vagina also, 1/3 of the vagina, top, no chance coming down. In addition to you remove the lymph nodes. Nodal dissection mean internal iliac, external iliac, common iliac, and obturator lymph node. That is what it's going to be. You see. If lymph node positive with malignant cells or margins of the specimen involved, the malignancy indicated to have a radiotherapy. Even after your dissection, urgent histology. I think we need to do a surgery and get the urgent histology. And when that is why with the house officer, remember when the next year, my name you will, most of you become house officers. Don't worry, right? When you come to the ward, And when you assist the surgeon, please, when you fill the form, say suspicious malignancy, urgent histology. It has to be written red ink or highlighted. And talk to the pathologist. That's a good doctor. Doctor with the sympathy, empathy will definitely talk. That's what you do when it happens to your mom, when it happens to your wife, when it happens to your sister. Do it for Dayavati, Mrs. Dayavati and Mrs. Siryavati. Then you become a good doctor, right? I have seen, because we are here, thanks to them. But we always forget that. We treat somebody else, right? We are here because of the thanks to them. But we treat somebody, we forget where we came from. Urgent histology. Tell the patient also, that's a suspicion. We need to trace the histology early. If you are discharging even, we get a number and we call them. I will call you if there's a problem. There need to be done anything else, we will call you very quickly. That's a good doctor. That kind of house officer make a consultant, specialist life also comfortable. And the society will be in a better place to live. Because you will not be murdered because of the cervical cancer. House officer, histology got misplaced, never come back, and ultimately you see when the report comes, patient is in the funeral house. That is the problem. Therefore, remember that as a good doctor, please do that. Right. Therefore, as a good doctor, you need to do that. I will give you additional marks. Even the mark is not there. That's how man with the feelings, right? You say urgent histology and I will follow it. That's a good doctor. If there's a suspicious areas, positive malignant cells, you do a radiotherapy addition to your surgery, right? Radiotherapy can be used as a first line treatment. Sometimes what happened? Now, where it comes, especially if the patient is medically not fit for the surgery, radiation can be used. Not only not fit for the, what are the things? Now, obese, huge lady, maybe 150 kilos. Never think of doing an operation on that woman, right? How can you do? Then you can do a radiotherapy, right? And there are ups and downs in the radiotherapy and the surgery. You resect it very well. No other much complication, only the surgical complication. Radiotherapy lead to a lot of necrosis, pain, damage, scarring. And this is the area where what you are removing is the most sensitive area of the woman, the vagina and vulva, everybody, that's the concern, everybody concerned. That make her whole life issues will be coming out at the end of the day, right? Therefore, it's up to you to discuss with them and make a decision. Therefore, radiotherapy has a first line sometime where surgically patient is not fit for the operation, right? Survival rate is same in both treatment. You see, that is the other beauty. Therefore, why you should carry a high morbidity and mortality of the surgery, and then you better give a radiotherapy. That will be all right. And then you need to write this sentence is very important. Then follow up is necessary to detect recurrence. This is one of the most important statement in an answer. It is a very important writing because and you need to keep your mind. I'm not going to give up this patient. I will get her down. I will go through it. That's the other important thing. Now you see that's all about the basically writing an answer for this structured essay. Within time allocated period, legible handwriting, and write precisely and concisely, answer to the question. Easy, then you'll be all right. Even you 2020, if you made the lazy score current, 40 you have already gathered if you write correct answer, right? And then this one is you need to take only 10 to pass that question. It's not difficult. Therefore, remember the paper don't be think that paper going to be more difficult. No, what can I write? No, you can do that. Because what we are asking, the simple question that is daily you come across in the clinic. Any questions that ekam kuth tiyanawada ahanna? Are you all right with that? Happy? පැහැදිලිද ඒක? අපි එක question එකක් අපිට කරන්නත් පුළුවන් වගේනේ. අපි තව එක question එකක් කරමු, right? ඔන්න බලමු ඊළඟට ආයෙ එනවා. We get another third question, right? Is going to be obstetric questions, complication multiple pregnancy, right? Again, structured essay. You are in a better wicket. You can score marks. Comfortable when on a mind comfortable. I think with the stress, you know that they have proven, their evidence-based studies proven, with the stress, the way the marks you're going to get it come down. Even though you are a good candidate, you are going to get 100. You know everything about it. With the enormous stress, will reduce it up to, it cut down by 70%. In 30% විතරයි හම්බෙන්නේ. 100 ගන්න පුළුවන්. එනකට වඩා හම්බෙන්නේ 30. Hey, you are enormous stress. Brain cannot work it out itself. Right? That is why you should be relax yourself. When it comes to this, a bit of exam stress will be there. Even we had it and we still will have it now. Even whatever we kind to come even for the lecture, a bit of a stress will be there. But that's better. That is why you are doing the lecture. That is why you are in the exam. But larger scale, major scale, you should not have a stress. ඒක නැති කරගන්නේ කොහොමද? Writing answers, discussing with your friends, familiar with the questions. Because now these questions, if you go through all the past papers so far given in the faculty, anything else? Have you a female got any additional an additional organ after this? This is nothing. No, same thing. Same blood thing from the vulva, vagina, cervix, and the uterus, and the ovaries, and things broadly come. Therefore, that's all. Therefore, go through the all past papers before the exam. Write answers yourself. If you're lucky, and if you get it to us, we will definitely correct it and give you. If you want to comment on us, we will definitely discuss in front of all of you. And that can be done. Take a familiar when another lazy. Then question. List 5 maternal complications associated with multiple pregnancy. 5 maternal complications associated with multiple pregnancy. See, then බලන්න answer එක දීලා තියෙන හැටි. කාලේ එක එක විදිහට හිතන්න පුළුවන්. Hyperemesis, right? මුලින් ඉඳලා පටන් ගත්තම ලේසි hyperemesis දෙමිනාරු. That's the commonest thing, no? Because most of the people with the multiple pregnancy, they get excessive vomiting, which need admission and treatment. Hyperemesis gravidarum. It cannot be just a vomiting. It is a vomiting which need admission and IV resuscitation has to be given. Right? Anemia, preeclampsia, they are common issues. Gestational diabetes, because the pregnancy is a diabetogenic. If you go back to physiological changes, which I have dealt with you all, and it clearly says a diabetogenic condition. It's a steroid, enormous amount of cortisol come into the picture. It's like you are taking prednisone only. The pregnancy is a cortisol secreted tumor, right? The gestational diabetes comes, provided your pancreas is not competent enough to overcome the increased glucose load. And that's the result. Polyhydramnios, right? That's quite common because the larger placenta in multiple pregnancy, more fluids comes out. Placenta previa, larger scale placenta. What happens is when the placenta large, definitely it lies in the lower part of the uterus because the placenta has to go inside the uterus. It lies lower part, cover the cervix. Placenta previa. Antepartum, postpartum hemorrhage common because of you get basically a large placenta previa, abruption common, and you get antepartum, postpartum hemorrhage. Antepartum hemorrhage due to that, postpartum because overstretched uterus. Uterus is stretched. Then the retraction take place. When the uterus is going to contract or retract after that, expel the fetus, it's difficult. Overstretched. Uterine inertia, and then postpartum hemorrhage is the result. Therefore, you need to be alert on that. And definitely very high chance of operative delivery. Multiple pregnancy end up with the operative delivery most of the time. can have a vaginal delivery. It's not a normal vaginal delivery. It is a vaginal delivery. You can have uncomplicated vaginal delivery, or most of the time instrumental, maybe forceps or vacuum or cesarean. There are so many complications you can think about this thing, right? You don't want to write in detail, just a list. List don't write details. List hypergamy, anemia, preeclampsia, you get marks. And they will say how many? Well, make it see what we say. Understand? Then it comes. That is why make a when you are doing a scholarship exam. The scholarship exam, what you learn, you learn to follow the instructions. Remember, that's what most of you are not doing. I'm telling you, not only that is other Sri Lankan people are not doing, right? They don't follow instruction. They have their own way of doing things. That's not going to work. When you are living in society, you need to follow and abide by the rules and regulations. List 5. List 5 fetal complication as well as the multiple pregnancy. This is a maternal. This is a 5 fetal complication. High risk of miscarriage, certainly, but there's a chance of chromosomal abnormalities. And high risk of congenital abnormality. Neonatal defects are higher. Cardiac abnormality, gestational abnormality, fetal growth restriction, fetal complication, we are writing in. Preterm labor, fetal complication. Perinatal mortality increase, death in utero chance is higher. Increased risk of evidence of cerebral palsy. That is also higher. And the vanishing twin syndrome, that is also there. Vanishing twin means, even though you say that at the first day scan, you say there's a 2 congratulations and you can get everything, and then maybe another few weeks time, few months time, you say there's one is missing. The patient gets upset. What happened? Then you looking for that was existing. No, that was not there. Vanishing twin. Just a scar is there. That's maybe the small part of that, right? Okay. Very easy for 20 marks. I think time is getting closer. Complete very wavy, right? I think we probably will do it the next one next time. This is what you should be talking about. Then, but just imagine now, this is what you should be doing. It doesn't matter. Describe the basic principles of delivery of the second twin of twins with fetal distress after delivery of the first of twins. The complicated question. It's not the twin delivery they are asking. Examiner asking, that is why follow the instruction. Describe on the keywords. Basic principles, basic kind. Not lengthy discussions. Delivery of the basic principle. Jot down. Second of twin. Due to fetal distress after first twin. First twin uncomplicated, delivered. But now second twin the fetal distress. What are you going to do? What is your aim? Must be delivered by fastest and safest route. That is the important thing. Fastest and safest. Right? If Kepalik and the placentine part is at or below the steer spine, instrumental delivery can be attempted because it's fully dilated with the first one already delivered. Everything is ready for the delivery. And now the second one come down below the steer spine. Easy. No high instruments you need, and the instrumental delivery that's the safest route, fastest route. But remember the preterm 34 weeks. Then you better not to apply ventouse or face presentation. Face you will come out, suck out the whatever inside the face. That you need to consider. Like a Leon better. These are the carrier mark, right? Good one. With breach, you assess the second twin. First, externally, you can assess. Internally, also you can assess. Then and there, what is there? But can assess what is the presentation? Kepalik. Kepalik means hard, palatable mass, rounded mass. buttock unless calcified buttocks, right? You deliver. The breach, then the breach extraction may be attempted by experienced clinician. Experienced clinician, whoever the available clinician is going to do that. Therefore, person who is ready to deliver the twins should be able to deliver normal delivery, breech delivery, instrumental delivery, and he should be competent enough. If you are not competent, don't hang around the delivery of the twin just to do the delivery. You can learn the delivery, but some competent, experienced person should be around. It may be the senior house officer, maybe the registrar, maybe a senior registrar, or none of them are competent. Only the consultant should hang around. There's no excuse for that, right? Then the breech extraction is a different story, because the breech extraction, present obstetrics, they don't allow, except on this situation. Extraction means you pull it out. Gentle pulling. Pulling means not the pulling like removal of the many of you just take gently to pulling it out. And grasp the feet of the fetus and gently pulling them through the vagina and aided by a maternal effort. And you all ask Amma, push. You tell Amma, tataman, baby, you give a sort of, you can give a running commentary to the mom. Mom will be more confident, more happy. She will push definitely. Because that is why mom, Amma kiyane kane. Amma kiyane sielu de parityak karana mattaka tiyagana. Me sielu de pudduma amaruwakin amma karana pudduma vedanaවක් tiyawa. You need to remember that. Don't forget that until you keep your eyes closed right in this birth, right? Amma pudduma dukak vindala dein, right? Or breath and breech extraction, pulling them through the vagina and aided by maternal effort. It's important. The arms will often become nuchal and Lausset's maneuver will then be required. Because when you are pulling them down, normal breech delivery, you need to follow the breech. Treat the breech delivery today. You don't want to explain the Lausset's maneuver in this question, remember. Make a basic principle. Fastest killer was safest. Kepalik nang, take it out. Lower nang, spine instrument deliver. And then then do the breech extraction gently. Lausset's maneuver need to be applied. Modern obstetrics practice second nut twin with feet ready is the only acceptable indication for this procedure, because the breech extraction we don't do unnecessarily, because that can have its own disadvantage, right? Damage the fetus, damage the mom, a lot of things. With the transverse lie, you can do an internal potalic version. Sometimes baby lies transverse. The first one comes out, second one transverse, and then you do an internal potalic version and take it out, right? And again, the breech extraction. Vaginal delivery not possible. Then you sometimes the baby big or uterus contracted, the commentary given, no way that you can do. Please run into a cesarean should be performed. That is why when you are doing the twin delivery, please inform the theater that you are heading for some time if you need a surgery. I'm the good house officer. Ready the blood, cross match. 3 units of blood minimum. Inform the pediatric team. It's a must. The pediatric inform inform the usually second pediatric team. But better you write. Inform the pediatric team and then you write down. At the end of the day, you write. Please write down, and the risk management also important, because what has happened, what went wrong, and things can be discussed. All right. I think that's all about that. We have discussed basically 3 questions today, and we will next week also we'll do another 2 or 3 questions. Then you should be able to write the answers for the exam. Now you realize that the exam is not that difficult, right? It's not very difficult, provided that you read the question very well, formulate your answer. What is skeleton? When I'm answering, I always do that. මගේ answer එක මම ලියනවා. හැබැයි මම මේ පැත්තක පොඩි note එකක් දානවා. Then the examiner, even I didn't have a time, examiner knows that what I have formed, what I have planned. You will get marks for that. If I'm the examiner, I definitely give you a mark, because that person has already know what to do, what not to do. It was, and then legible handwriting is important. Write only necessary information. precise and concise. එතකොට long question එකක් නම් you have a head, body and tail. ඒ answer එකක් වෙන්න ඕනේ. And nice English. Language always matters there. Grammar is also involving, but we very rarely we penalize for the grammar. But it matters. It impress the examiner. Good grammar, good English, definitely will be there, right? And then structured, they say easy because you write only necessary thing. 5 nang have list the 5, list 5 only don't 6, and name 2, write 2, and like then this basic principle, right? The basic principle, right? Again, legible handwriting with that space, you should be able to do that. Any questions you want to ask? Happy? සතුටුයිද තේරුණාද? පහසුයිද? දැන් විභාගේ පාස් වෙලා ડોක්ටර් වෙන්න පුළුවන්ද? Right? I wish you all the best and good luck. Right? In the absence of questions, probably we will see you next week. හැම දිනාටම තෙරුවන් සරණයි. We'll see you again. සතුටෙන් ඉන්න හරි. Happy, enjoy yourself. Don't keep your brain down. Always happy mood and concentrate, read. And read about the textbook again. Your then teachers, illustrated, Professor Arul Kumaran textbooks are also very nice. And they go through the all past papers. Try to answer yourself. Don't confident now that you may be with me for this hour, but you think that you can write. No, that doesn't mean. You write yourself. Please go today when you have a free time. Get the question that what I have discussed. Write to yourself. Write your answer. That's all right. Don't worry, right? Write your answer, and then you will be able to do that in the exam. Okay. Hari. Kena besar na betul. Apa yang memang saya seperti ini. Okay. Maka anak pulang wage දේවල් නේ තියෙන්නේ මට ගලව ගන්න දෙයක් නැහැ නේ. ඔව් හරි. කොහොමද? එහෙනම් රෙකෝඩ් දෙන්න දාන්න.